What's up? Thanks for tuning in. We're going to talk today a little bit about Robert F. Kennedy Jr., the Secretary of Health and Human Services. He was just appointed last week. And when I say, when I looked at his confirmation hearing, it was like, who, why, why, in my opinion, the goal for the Trump administration is to tear down the government. When you go, when you interview for a job, you try to make a good impression on the person that's interviewing because the saying goes that you only get one chance to make a first impression. This person who is a denier of all vaccines, in my opinion, Trump is trying to tear down the nation and he's hiring everybody, all the conspiracy theorists to help him in that regard. So like I was saying before, when you go and interview for a position, you try to put your best foot forward. You try to make a lasting impression. You try to, in interviewing you, or the people, or the panel, or the board that's interviewing you. In this case, it would be the Senate Confirmation Committee or whatever, whoever. But needless to say, I'm going to let you hear a little bit of his confirmation hearing that I thought it was interesting. I couldn't believe what I was actually hearing. So this is Senator Maggie Hassan out of New Hampshire, I believe, and she is grilling him on Medicaid or Medicare parts. Well, we'll see. So check this out.
Yesterday's hearing, you really showed a lack of knowledge about Medicare and Medicaid. So what is Medicare Part A?
Medicare Part A pays mainly for primary care or physicians, and then Medicare.
No, so it is about Medicare Part A is seniors coverage for inpatient hospital care. What's Medicare Part B?
For physicians and doctors, Medicare care Part D.
That is coverage for outpatient care and home health. So what is Medicare Part C?
Medicare Part C is a program where it's the full menu of all the services A, B, C, and D for Medicare.
It is Medicare Advantage, which it's the private insurance option for seniors on Medicare. So, Mr. Kennedy, you want us to confirm you to be in charge of Medicare, but
he didn't know nothing about nothing. Look, you can simply go and Google Medicare Part A, B, and C, and it'll give you more of a a better answer, a better reply to the answers, the question that she was asking in that. That's just, you don't care. He could have at least tried. So look, speaking of, you can go and Google. I did go and Google what Medicare is, and Medicare is it's a federally financed insurance for seniors ages 65 and up, and you get certain disabilities you can qualify for Medicare, and it covers hospital care, skilled nursing, home health services, prescription drugs, and again, like I said, it was financed by the federal government. So that's just a simple Google search. So, guy didn't care. So watch this.
It appears that you don't know the basics of this program. So let's turn to Medicaid. No, I had to correct you on several things.
Oh, you
let's
just
turn
added
to Medicaid. Yesterday,
you didn't correct me. I didn't get it wrong.
Mr. Kennedy, my time is limited.
So he didn't know anything, and this is the guy that's in charge of. He's the Secretary of Health and Human Services. This is what y'all voted for. So anyway, I'm not gonna drag this video out too much longer. Let me know what you think in the comments. Tell me what you if you agree with his appointment or if you disagree with his appointment. I strongly oppose his appointment. I deal with common sense and science and what's real, not just feeling and I'm just giving an example. When you, I don't know, when you got a stomach ache, you go to the doctor, right? And the doctor tells you to, Pepto-Bismol, Verner's, whatever, gives you antibiotics, whatever. Um, you don't go to a custodian and tell him that your stomach is hurting or you got a headache and ask them for advice and tell them, ask them to tell you what type of, remedies they got to make your headache go away or make your stomach ache go away. You go to the professionals. We got a group of people here that go head over heels against what the professionals and what the people who have been trained and got years and years and years of experience are telling them. Like, just because in my opinion it's all for financial gain. Some type of way you got to follow the money. I'm not sure how it goes, but these people are just, it is what it is. So anyway, like I said before, I'm not gonna hold it out too much longer. I'm gonna go ahead and end this video. But like, comment, subscribe, share. Hopefully I said something to get you interested and keeping up with what's going on in the news. There's so much, and I know I'm a couple days late on this, but there's so much going on, so much to report on, so much to research. I just had to put this little video out here real quick. So check out Robert F. Kennedy Jr., and he's our Secretary of Health and Human Services. Check him out. All right, y'all have a good day.